Well, welcome back. Tomorrow night, the American Heart Association will host an insightful conversation discussing why communities of color continue to be disproportionately impacted by chronic disease, I should say. We're joined now by Jasmine Johnson, the chair of the local Go Red Women's Campaign. And Jasmine, what made you want to put so much of an emphasis on heart health in the Black community?
Well, good afternoon, Shannon. Thank you again so much for having me on this afternoon to talk about Go Red for Women and the overall 2021 campaign, and of course, the Go Red for Women couch conversation taking place tomorrow evening. For me, the reason I chose to go red is, as you mentioned, the disproportionate impact on communities of color, family members, and me losing my grandmother at 55 years old, the summer before my senior year of high school, to a cardiovascular event has definitely made me more interested in understanding my health history, as well as making sure I'm amplifying and advocating for individuals in the community who have disproportionately been impacted and see additional risk factors, by social determinants of health. And that is why I have chosen to lead the campaign and go red for women for 2021.
And tell us a little bit more about what that means for you. What will you be doing over the course of the year to bring more awareness to the issue?
Well, we, due to the COVID climate, of course, have really launched the Go Red for Women couch conversations just as a way to connect with individuals across the community in this virtual realm, to still advocate, to still raise awareness and have very pointed conversations. So last May, when the campaign launched during National Stroke Awareness Month, we launched the Go Red couch conversation with Vivian King, that I know is very familiar name to those over at TMJ for as well. And just last month, the series that we previously just had featured Donald Driver, his wife, alongside Sydney Moncrief, his wife, and of course, Brian and Nicole Lammy moderated that discussion. So still being able to raise awareness as well as insert additional ways where people can financially support the campaign, but at the same time, ensuring that we're having very important dialogue and conversations, even in this COVID environment when we can't convene in large numbers and gatherings.
And again, we were showing the invite for tomorrow's conversation that really kind of gives a historical perspective of why there has been this health disparity.
Health disparity, Shannon, is also, talking about the distrust in the healthcare system from communities of color, and rightfully so, from things that we've seen with the Tuskegee, Scuddy, and other elements, Henrietta Lacks and things of that nature that we have experienced as a community over time. But, there's been so much advancement in the healthcare industry and advancement in technology, and why still people of color need to, understand and bridge the distrust in healthcare, but still take an active role in advocating for our own personal health and those within our families and across the community. So the irony that February is also, Black History Month and American Heart Month, and really being able to understand the history of health, how we got here, and what we need to do to pick up our own mantle and understand and take a personal commitment to ourselves and to our family, specifically because of the disproportionate impact that people of color have when it comes to cardiovascular disease.
Jasmine Johnson, the new co-chair for the Go Red for Women campaign. Again, we look forward to hearing you amplify your voice on this issue. The Go Red for Women couch conversation, The History of Health, is tomorrow at 5:30. We have a link to register at tmj4.com/links. It is free.